Good morning. Welcome to Psyfeld. We are live. This morning's discussion will be on the episode The Truth. So where would the group like to start?
We can start with the reoccurring theme of Jerry thinking everything's about him.
Can you give an example?
So George breaks up with his girlfriend, and Jerry's not like, "Oh, I'm really sorry to see my friend go through something tough." He's just like, "What's she gonna do about my taxes?" And that's like seemingly all that matters to him.
Yeah. Okay. So again, just to review what we discussed last week, this is egocentrism, which is simply one's incapacity to view anything from a perspective other than one's own, right? Egocentrism would be certainly the obstacle or the path taken away from empathy, which is the direct opposite, and that is the capacity to actually approach a situation from someone else's perspective. So again, we're not going to get this concept of empathy confused with sympathy. They're very separate concepts, right? But individuals are egocentric when during a developmental phase. That's completely a cultural norm. And then at some point they realize that there is something larger than themselves, and they begin to develop empathy. Right, so that's a general idea. So again, the prequel to this, if they were going to make a movie, would be looking at a young Jerry Seinfeld, the character, at or around the age of 3 or 4 or 5, and get an idea of his interaction with his parents. And why wasn't this person's child able to develop empathy? Because he clearly remains egocentric now in his late 30s, right? Early 40s, towards midlife.
Even like the reason he's in this type of situation is really interesting, right? Because he like gives his donation to basically impress someone in picture outside. And she like calls him out for it. But he makes it seem like it's really Kramer's fault and like threatens him, but actually do anything about it. And I feel like that's just awesome how Jerry is. He said a lot, he doesn't ever do a lot.
Yeah. Again, his motives behind what he does are certainly not altruistic. They're again self-centered.
I think even when Elaine said that Clinton's pregnant, you really concerned, they're like a little jealous. Like did any like negative emotion you want, it seemed like he was excited or like intrigued by that. But yeah, I just had this interesting thing. And if they want to date and they see each other, but yeah. Oh.
Yep, that's right on here. Now, again, egocentrism is it not? It's a risk factor for developing a future mental disorder. It's not a mental illness. Certainly, in and of itself, it can result in clinically significant distress or impairment for the individual, or Jerry, even absent a diagnosis. Unfortunately, in psychiatry, we don't have much to do there in terms of being able to discuss, quote unquote, what's going on with the patient. And you're certainly not going to be able to label it, but psychotherapy certainly could get at the core of this anyway, whether you have a diagnostic label or not. To my knowledge, since 9 seasons, and I've watched 9 seasons fairly repetitively, I'm not so sure I ever remember Jerry Seinfeld, the character, engaged in therapy. Yeah, that would be its own. Yeah, that would be a nice spinoff. Yeah. So it really should surprise none of us. Not only that this persists, but this persists right up to the finale, right? I mean, I don't give anything away, but boy, the finale really emphasizes what RWJ Medical School has been saying, I think, for the past decade and a half about this character and these characters. Any other observations for Jerry? No? What else did you say?
I thought George, when he was breaking up with, I forget her name, but he was like, so like he emphasized the importance of the truth, and then when Elaine like told him the truth about him, he was like resistant to it and upset by it.
Yeah, and this doesn't come up all that much, and it's relative import, but when we provide a mental status examination, one of the things that we have to render an opinion on is reliability. And that has some relationship, might even be loose, with insight. Insight is its own domain of the routine mental status examination. If you learn the MSC through the acronym ABC stamp licker, it's the I in the acronym, insight. There's a diagnostic label, superficial insight, where an individual will say the right thing, but otherwise demonstrates that they don't have insight. So they're able to verbalize it, but there's no follow through especially through observable behavior. This might be an example of superficial insight, right? He says what we expect him to say, but there's no follow through. And in some capacity, his behavior seems to contradict what he's saying, right? So that might be kind of described as a superficial insight. Just to kind of carry through with the mental status examination, usually when it comes to insight, we say intact versus poor or limited. But then there's this other qualifier, superficial, which is kind of in a middle ground. If you hear it, you've now identified it, albeit in a situational comedy. What are some of the any observations or thoughts as to why George has superficial insight? Yeah, I do. I think a lot of it has to do with the conscious versus the unconscious, and that he knows what to say. So the superficiality lies or is localized to this cerebral cortex, but under that cortex, subcortically, subconsciously, there are other thoughts, desires, impulses that certainly deviate in a different direction here. And to not verbalize what he verbalized might require him to take a little bit of a deeper perspective, that is, delve into his subconscious. And again, to get by his superficial insight, to get by the motivation, the ideology, would likely require psychotherapy. We've been in this discussion before. George clearly needs psychotherapy. So if there's going to be a spin-off with Jerry, maybe alternate weeks, we can get George in that same therapy session. Not the same session, but maybe the same therapist, the one down the hall, make for kind of neat, odd and even week series.
I felt like too with George, we kind of feel like his mental health stigma, right? He's like in the facility, and he kind of like whispering, talking in like gentle tones, and he's like really anxious about being in a mental health facility, which I think maybe speaks to why we haven't seen him in therapy. Like probably like a lot of stigma around like getting help, and like it's clear he thinks something is wrong with her. Are you putting that in?
Yeah. And that's clear.
Yeah.
And that shows up in other aspects, not only of episodes within this situational comedy, but certainly pop art in particular, no doubt. Why is he in the facility in the first place?
His girlfriend had or his ex had a impressive episode after the event there. It was also like, given all that we just talked about, I thought it was really funny to me how bad he felt about that situation and like the consequences of his actions and her like going through this, but like also like I don't think he really fully understood like again the superficial insight about it. So.
Yeah, and let's kind of move more towards that low-hanging fruit, because you are in the beginning of your clerkship. It's likely that she was hospitalized or is in the hospital for a depressive disorder, right? Or at least a depressive anxiety cluster, right? But focusing first on the chapter in the DSM titled Depressive Disorders, what makes your list? What are those few that are likely to appear on your shelf as a single best answer? You probably should review them quickly. Yeah, I think we'll start with major depressive disorder. Matter of fact, just to kind of take a step back, and then fast forwarding to perhaps 1 o'clock when you're in a case conference. One of the things I would like you to start to consider is that after you provide a psychiatric evaluation, a patient consult, in your mind, I'd like you to make a commitment. That is, ask yourself, the information that I received, the information that I was able to get, does it put my patient in choice A, that mood anxiety cluster, or is it more along the lines of a psychotic dissociative cluster? You don't get a choice C. So make a commitment, because the steps that you take from there will tease everything out. This works every time. So, and I know the way your brains have been formed, that you've got to quickly think of the single best answer. But this is actually going to make you show your work, which is much more important in clinical medicine. Right. So let's say, certainly applicable to George's girlfriend's case, you decide it is choice a mood anxiety cluster. The next step is to arbitrarily pick one illness from which to work. Okay. And I'm going to ask that you select major depressive disorder. Okay. I don't care if she presented with dig fast and you look me in the eye and say, Dr. T, I'm sorry, but this is clearly every board review book I ever own says that this is mania. It doesn't matter. I want you to really stick to the sequence of how to case formulate. Please start with major depressive disorder. And I promise you, in the subsequent steps, you'll see why.
Are you saying in general or right
In general,
now? Okay.
every time. And again, I understand it's arbitrary. Go for it, right? The third step in this process is to demonstrate your knowledge of the DSM to me. All right, so now I want to know the inclusion criteria for major depressive disorder as we're applying it now to this particular scene.
One of either depressive thoughts or anhedonia.
And
And then 4 other symptoms, which include changes in interest, guilt, appetite,
Psychomotor retardation.
perfect. Whether demonstrated in the script or reading between the lines, because Larry David only gets a half an hour to include everything and all of the above. Is it reasonable to assume that this character meets 5 criteria? I mean, I got a quick nod. All right. So again, and in this case, at least for teaching purposes, when in doubt, say yes. Let's just push through the microdidactic because its real value is to actually process it. At this point, if she does rule in, now you're going to tell me, or you're going to appreciate that this condition that you're discussing in case formulating called major depressive disorder is a disorder, a diagnosis of exclusion. So now you're going to tell me the 5 conditions that you have to consider, investigate, and rule out in order to continue with major depression as your provisional diagnosis. There are 5.
Medical.
Number 1, substance-induced depressive disorder. 2,
Persistent depression?
no.
No.
Psychosis, I'll give you that. Bipolar. It's good. Schizoaffective would be for schizophrenia, right? So that's actually, I'm sorry, I said 5. I way overestimated this. You guys have nailed it already. I'm thinking one number in my head. The other one came out. It's Friday morning, and quite frankly, I had half a cup of coffee this morning, so I'm still owed a half more. So again, I know that we have a limited script here. Does it look like this individual has bipolar / primary psychotic disorder, or that is depressive disorder that has been induced by the effects of a substance or underlying medical condition? No. Okay. So here we are sitting with this provisional diagnosis yet. One final step, and this is more of a thought exercise. If you guys are a little bit nerdy, like maybe some people in this room, if you've done this, do not be ashamed. This is where you should puff out your chest and be proud. If you've taken notes, right? And this is more applicable to movies than it is 30-minute sitcoms. But if you've taken notes and you right now would either in real time or hypothetically cross off everything on your notes page that has been explained by anything we've discussed up to this point, would there be anything left? Because if your answer is no, then we're done. And you have MDD as your most likely diagnosis. If the answer is, yeah, you know what, I've noticed blank, and blank would not be explained by depression, bipolar, substances, or a medical condition, well, you have to explain it. And the way we explain in clinical medicine and academic psychiatry is to broaden our differential, right? Create secondary or tertiary diagnosis or differential diagnosis. So the question here is, do you have a differential diagnosis? And the way you answer that question is through that thought exercise about what's looking at you on that notes page. Now, again, there's so limited information here because she's a minor character. But I still want to ask the question just for practice. Is there anything on that notes page looking at you in the face?
I'm curious about like the paper machine, because I know not how to pronounce it, and like this kind of sense of productivity of paper that's excessive. I'm wondering if there's any.
Okay, all right. So again, and the way you can go about this is twofold. One, look at the script. Sometimes the author, the writer, director gives it to you, right? You could actually go to the script and use the search function and search things like mania. I don't think Dig Fast will be up there, but and I've certainly done that before. And I've searched substances, right? And I've searched medical conditions. And if the answer is no, then you could re-ask the question and say, well, I mean, with an artistic flair, is there evidence even when it's not spoon-fed to me discreetly? And perhaps there is enough to keep it under differential. Cannot definitively rule out mania and therefore bipolar 1 at this time. So that's all we're saying, right? But this character and that scene does allow us to just review the case formulation. This is actually those 5 discrete steps of what is referred to in academic psychiatry as case formulation. Okay, there's another set of steps, very, very similar looking when you choose choice B, right? And you go the psychotic dissociative route. There, the arbitrarily agreed upon starting point will be schizophrenia, but otherwise, they will be the same 5 steps. And maybe you'll get a chance to do this at 12 o'clock today. Any other thoughts about that scene, George, or his girlfriend?
I think she was an interesting parallel because she has like these issues in her health, but she also does really well functioning. She has a pretty good job in health and she's pretty successful in the field. And yet she's like comfortable going to a treatment, whereas George is unemployed, unhappy, and not seeking help. And so I feel like it's an interesting comparison.
Very interesting. Yeah, very interesting. And I just wonder if Larry David just built that character with that in mind to anchor this. Yeah. Yep. Compare and contrast. Absolutely.
And there are also like 2 instances of George being really like heavy about money that I noticed. And like the first one was like when he dumped his ex, and then like she like asked if she could like pay her part of the bill, and he was like, oh no, that would be great. And there was like something later with like the cab that he could just like drive. I didn't notice that in the last episode that we watched, and I was like looking at for it. Just funny.
Yeah, he certainly has hangups there. There's no doubt about that. Yeah, there's no doubt about it. And his character is kind of interesting along those lines, and we're already 20 past the hour, so this might be one of the last teaching points. And that is, he is clearly frugal. He has a miserly spending style. And when that aspect of one's personality perhaps warrants independent clinical attention, i.e. results in clinically significant distress or impairment, one of the conditions that comes to mind is what?
OCD.
Yeah, absolutely. Obsessive compulsive personality disorder, which is a cluster C personality disorder. Now, cluster C personality disorders do have a relationship. They have a comorbidity with anxiety disorders. And I think at first glance, that seems to be supportive of perhaps this character having OCPD, or at least OCPD traits, because his frugality does result in clinically significant distress or impairment. It does. Now, having said that, when you look at other aspects of the obsessive compulsive personality, I'm going to ask you, I'll turn it and phrase it in the form of a question. Do you see it in George? Or do you see them in George? Any of them? First and foremost, what is OCPD? So probably should hammer down the diagnosis first.
You do like excessively controlling the environment around you, except in this case, it like kind of benefits your productivity.
Absolutely. Right. So what I'm hearing, putting words in your mouth now, is that the obsessive compulsive personality disorder is one that's characterized by what many people refer to as the type A personality, right? Excessive work at the expense of pleasure and leisure, the micromanager, attention to detail, perfectionist, right? Nowhere in the definition of this condition do you see the word obsession. So there's this condition, this personality disorder, is not defined through intrusive thoughts, nor is it defined through compulsive acts or behaviors, right? That's OCD. the anxiety disorder. Albeit there's again an association between the two. That said, does George have the type A personality? Far from it. Matter of fact, I think many early theorists would say that he's not an anal retentive. He's actually an anal expulsive. He's the opposite. Which again, I'd have to ask Larry David to confirm this. I think is part of why David creates this character, because it definitely juxtaposes Jerry, who happens to be anal retentive and OCPD. So they're an odd couple, right? They're best friends, and it's a very odd relationship when it comes to personality traits. Right. So George's character does allow us at least a window to discuss the obsessive compulsive personality, and in fact, to the extent that we can actually rule it out. Right. I mean, even when he eats, I mean, it's not nearly as, I guess, thoughtful or hygienic as Jerry is. Jerry will have an entire meal spoiled when somebody doesn't wash their hands. We've seen multiple episodes where he portrays traits like that. When George eats, for lack of a better word, he's a slob. Whether it's ice cream or spaghetti, and there's multiple scenes of him demonstrating an expulsive personality. All right, 23 minutes past the hour. Fortunately, we're not getting a good feed at all on the Instagram side. I apologize for the Wi-Fi today. Any final thoughts, whether it's this particular scene, George in general, or any other aspects of the truth?
It was interesting to see from the romantic thing. You don't see that very often.
Yeah.
And it was chaotic.
Yeah,
They-
yeah.
Right.
yeah. So I think it's a great pickup. Kramer really throughout 9 seasons, multiple years, is without an intimate partner. Again, looking at his relationship with his mom, there's dialogue there to support the etiology of why he has significant difficulty in forming intimate relationships. And this is just one example of that. He tends to be more of a loner. And I think a lot of his friends that he mentions, we have to question whether they truly exist. I guess whether or not, in terms of how to tease that out and how to begin to case formulate that aspect of who Kramer is, we have to first ask, and I don't have an answer to this, I really know, whether or not he truly believes these friends that don't exist do exist, or whether there's some other motive behind it. 60-40, I'm guessing that he has insight and he is not psychotic, but it's odd and bizarre nonetheless. We'll leave it there. 25 minutes after the hour, we're going to log off. We'll log right back on Zoom for our morning rounds. We'll have the interns, and we'll see you guys on the other side there.